swelling, any hardness, and you'll feel that better when you're pushing it up against the bone. Okay? And then we move into the cervical chain. Is that correct?
Yes.
Yes. So, what is the muscle that we look for as a guide of where to check our lymph nodes?
Sternocleidomastoid.
Their sternocleidomastoid muscle. Now, if I have her look down and to her right, do you see how that sticks out better?
Yes, that's nice.
Okay? So bidigitally, I'm going to feel the supraclavicular nodes, and then bimanually, I'm going to feel the deeper clavicular nodes. Do you guys see that? Mm-hmm. So first it's bidigitally, and then bimanually. Okay, then I'm going to have her look down and look on the other side, and same thing. Bidigitally, and then bimanually. Okay? Then, what's here? So what nodes are here?
Clavicular
Supraclavicular node. So it's just above running along the clavicle. Okay? And you can do that, they call that one is bimanual bilateral. Okay? Now we're going to check the sinuses. What are the sinuses?
Maxillary,
Ethmoidal, frontal.
Ethmoidal and
maxillary.
maxillary. So I'm just going to, remember I said do it from the front so you don't get a glove in the eye? Do it from the front and just gently palpate, check for any tenderness, any raising. Okay? And now, what do we check next?
The glands.
The glands. Now, from the extraoral exam, we're just checking the parotid glands. Okay? And we're just checking bimanually, bilaterally. And now we're going to check the thyroid. Now, are we able to palpate the thyroid directly?
No,
not really, but we're
always.
kind of checking the area all around it, okay? So you can see I'm just gently pressing around it. I have her swallow. Go ahead and swallow. I know, it's hard on the spot, right? And you want to make sure that it moves freely up and down, that there are no deviations to it, that it's not trying to get around an enlargement there, that everything is nice and depressed.
So is that bidigitally one?
This one is considered bimanual, bilateral.
Okay.
So when you check like this,
Okay.
okay? And then you just gently hold one hand, so manually for the checking of the swallowing, okay? But otherwise it's bimanual, bilateral. All right, so now I'm done with my extraoral exam. What do I do?
Remove your overgloves.
So I'm going to remove my overgloves, okay? And then we're going to do that intraoral cursory exam. So I'm going to go ahead and place my patient's bib. I'm going to ask my patient to put on her eyewear. And now I'm able to actually look inside of her. Can you guys push that part? Yep.
Almost got you.
So actually, I'm going to keep her upright a little bit so you guys can see a little bit better. Okay, so what am I looking first?
Lesions that stand out.
What are we doing?
The tongue.
Buckles,
The lips.
foci.
So we're going to use the mirror to do what? Why? What is this portion called?
Cursory.
The cursory exam. And what's the purpose of the cursory exam?
To examine
Make
the back
sure
of
that
any
there's
lesion.
like
So check for any
Lesion.
lesions that could
Maybe malignant.
be contagious or infectious. So we need to know right away, can we proceed?
Yeah.
Okay? So I'm going to have her open real quick and say, ah. Okay, and depress. Make sure that if I am touching anything, I look before I touch to make sure that there isn't any lesions in there, anything that would cause discomfort, okay? So I did my cursory exam, I checked everywhere real quick, it was a very brief look, and now we're gonna go into a more detailed exam, correct? So what are we gonna start off with? A lips. So do we know all of the different anatomy of the lips yet?
Vermilion border,
Vermilion border is where?
lip liner.
Where the lip liner would go? Where would the lipstick go?
On
The lip.
the zone.
Zone. Vermilion zone. You did. Okay. What about that area right before it goes into the wet line?
Wet lip.
Wet line.
The wet line. So right where the vermilion zone meets that alveolar mucosa, right? And then what about the corners?
Commissures.
The commissures. What about this depression right here?
Filtrum.
And then what about the part that sticks out just a little bit towards that center upper lip?
Nope. I don't remember that one.
You're almost there, guys. Last one.
Starts with a T.
Starts with a T. Tubercle. Tubercle. So we have the filtrum, the tubercle, the vermilion border, vermilion zone, the commissures, and the wet line. Okay? Got it? So of course, before we touch anything, we're looking, right? Always look before you touch. That should be a rule for everything. So look before you touch. So I already did my visual inspection. I'm now going to pull the lips out and I'm going to palpate. And I'm going to palpate bidigitally. Okay? And then look and then palpate bidigitally. Okay? All around. All right? So what are some of the things that we can find on the lips other than ulcerations or herpetic lesions? What else?
Color change.
Fordyce granules. Remember, it's those enlarged sebaceous glands, those little whitish, yellowish bumps. Okay?
Angular colitis.
Pits. Angular colitis. Chapped lips.
Commissural pits.
Okay. So then, what about the oral mucosa now? So we have the buccal, the alveolar, and the mucosal, right? So with the buccal mucosa, again, we're looking before we're going to do bidigital palpation. It ends up being bidigital bilateral palpation. Okay, and we're checking for anything hard. And then we're checking the alveolar mucosa, right? So we want to go ahead and use digital palpation. So first we're looking and then we're palpating. Yes?
Are we going to be doing that when the patient's laying back? Are we seated?
Yes, I just had her raised. I told them I had her raised right now for the intraoral exam because I wanted them to kind of see a little bit better. Yes.
Oh, but they're supposed to be
We'll be sitting.
Yes.
In a supine
position.
I said, yeah, I was starting to put her back, and I'm like, oh, I'll keep her upright a little bit so you guys can see better. I don't know if you guys, you might want to
kind of
look at over
see.
here.
See when you're on this side.
So we're checking, remember, for the frenal attachments. So you're going to pull the lips here a little bit over here. You see the frenal attachment? You're going to pull it up here, check up here as well. Make sure that, what if this frenal attachment's too low? What can that cause?
Diastema.
Okay. What about this one being too high?
Receding.
Recession could cause some recession or any other ones. There's also frenal attachments over here. If this one was too low, it can cause the same thing. Because of the constant pulling, it can cause some recession. What if there's some extra tissue on it? What is it called? Tissue tag? Frenal tissue tag. Okay. Again, it's not anything that would harm them. It's just not considered normal. So you would write that in your E&I exam as something that is abnormal. Okay? So when I'm feeling the alveolar bone area, all of this, again, I'm doing it visually. I need to make sure I'm also looking and palpating that retromolar pad. Where's the retromolar pad again?
Behind the distal of the molar.
Distal of the third molar.
Distal of the terminal of the mandibular molar, or terminal tooth. What about up here, behind
the terminal molar of the maxillary arch. What is this called back here?
Maxillary.
Maxillary
tuberosity.
tuberosity. So we're going up there again. We're gonna look. I should look first before I touch it, and you're gonna need your mirror to see back there. Okay? And then the same thing on the other side. All right. Now, what if there's extra bone over here in the buccal area? Exostosis.
Yeah, and then
Exostosis. What if there's extra bone here in the lingual of the mandible?
Tori.
Tori and torus. What's the difference between tori and torus?
Tori is
Tori
two.
is one. Singular. Okay, and then are we going to indicate
Left and right.
Left or right.
left or right?
Bilateral.
Okay.
One side.
So then what are we doing after the oral mucosa? Oh, what about our duct? What duct here is on the, in that buccal mucosa over here? Okay, so the parotid gland is here. What's the duct? Stenson's duct. So remember there's that parotid papilla that sticks out. You want to come here and take a look at that? Yep. See that right there? That's the parotid papilla. And that's where Stenson's duct is housed. So that's where it's going to be secreting from. So when you dry this area, you want to make sure it's nice and dry. And then they say you're going to milk it. Okay? So
massage it.
yep, just massage the area, and then you can see that it's starting, you see the saliva starting to secreting. Okay? And we want to make sure that the secretion is clear, that it's of normal flow.
Can you get a picture of that?
No, we're recording you.
All right, so now we're done with the buccal mucosa, the labial mucosa, alveolar mucosa, mucobuccal folds. Now what are we going to check?